just to go over a couple housekeeping rules while we're waiting. If you guys have any questions, please feel free to put them in the chat. Typically, what I'll do is at the end of the presentation, reserve some time at the end to answer any questions as well. Also, open up a Q&A session as well for any additional questions that aren't placed in the chat at the end of the presentation. Okay, guys, so in respect for your time, we'll go ahead and get started. I think we had one additional person jump on, and it is now 12:02 p.m. So thank you guys for coming on to the webinar this afternoon. Dr. Chris Williams with Regenexx Cayman as well, and we will have a great talk for you here to discuss several different aspects of regenerative medicine, orthobiologics and orthopedics, and some of the things that we're doing that could be potentially applicable for you. And happy to jump in at the end, as I mentioned, to answer any questions that you have, comments, or any feedback that you may have as well. So at the end of the webinar, we'll carve out some time for Q&A. And if you want to just go ahead and put any questions that you have in the chat, initially I'll run through those at the end of the webinar, then open up the session to any live questions as well. All right. So here's a quick table of contents of what some of the things that we're going to be talking about over the next several minutes here, kind of giving you an outline of things. But this talk is really for three groups of people. So anybody that's dealing with any long-term orthopedic issues that you're having, whether that be joint pain, tendon and ligament issues, back pain or spine issues, or just multiple areas that are bothering you on a regular basis. That's group number one. Number two is people that have tried things that just haven't been working, whether that be steroid injections, ablations, or even surgery. You know, you've tried alternative things that just haven't been working, or you're interested in trying something that's not as invasive as, say, a surgery per se, as well, or looking for some better long-term outcomes instead of some of the more temporary things that we can do, like steroid injections. That's number two. And then number three, people that want to be proactive. They want to stay active. These are people that maybe weekend warriors, fit individuals, or even professional athletes or semi-pro athletes that have a level of fitness and want to maintain that level of fitness or prevent injuries from occurring as well. So sometimes it becomes very beneficial if we think about things from being a proactive standpoint instead of being reactive as well. All right, so Regenexx. Regenexx is a company that's been around in the orthopedic space since 2004, have been the leaders in the field, and we specialize in treating orthopedic issues with biologics. And that includes things like PRP, stem cells, fat tissue, and we'll get into all of those things as well. You know, we've published the vast majority of the research on stem cell treatments for orthopedic issues, roughly about 44% to date. And have been doing these things since the past 20 years. In 2005, we did the first stem cell treatment for knee arthritis in the world at that point in time. And in 2006, we did the first intradiscal injection into the lumbar spine with stem cells in the world at that time. And so we're always trying to push the envelope forward to get patients to have better outcomes, but also publish research to see what allows these things to work better and who we can refine in the treatments to make sure we're getting the best outcomes for patients in the long run. So here's a little bit about myself. I am one of a group of board certified U.S. physicians that work down in our site at the Cayman Clinic in the Grand Cayman Islands. I'm the medical director here. I am from Jacksonville, Florida, born and raised. I went into the Air Force out of high school, a military veteran as well, and did all of my medical training at Emory University in Atlanta, including medical school and residency. Then I did a fellowship in Colorado with the founder of Regenexx, Dr. Centeno and Dr. Schultz. Stayed on staff there to teach as well, and am teaching faculty at Emory, and I have a practice in Atlanta as well. And the other 6 physicians that rotate here are all board certified and fellowship trained as well in either orthobiologics or sports medicine or interventional pain management as well. So good crop of physicians that are highly specialized and focusing on treating orthopedic issues as well. We all teach conferences internationally, worldwide, and also locally to aspiring physicians to learn how to do these techniques as well. this is just kind of a bird's eye view of how our treatments are different. But, ideally, we want to repair damaged tissue, but also heal things that are damaged as well. And there's a difference in looking at the scope of regenerative medicine of what's possible. Not everything is going to be able to be completely reversed, but knowing what's treatable and what's not treatable, and sometimes when to refer for surgery is always going to be the best thing. So, let's kind of jump into things a little bit more. So, what can we treat? And we talked about these things, a couple of them mentioned briefly earlier, but when we talk about our spine conditions, we treat a lot of spine things. Spine is, particularly lumbar spine, is the second most common thing that we treat. And that can be for anything such as a pinched nerve in the low back, disc herniation, arthritis in the spine, disc degeneration as well, or ruptured disc also. So people commonly experiencing the sciatica, sharp shooting pain, numbness, tingling, etc. So spine is a very common thing that we treat. Number one on the list probably being knee issues, particularly with knee osteoarthritis. Is the most prevalent, one of the most prevalent conditions that walk through the door of a primary care physician or orthopedic specialist office, and spine conditions being a top second to that. But we commonly treat and get great outcomes for things like knee arthritis, degenerative tearing and tearing acutely of the meniscus, ligament and soft tissue issues like ACL, anterior cruciate ligament tears. We published several papers looking at randomized treatment, controlled treatment of stem cells for the treatment of complete ACL tears and having good outcomes as well. And for knee arthritis, our goal is always to prevent a knee replacement. And we've been able to have good success with treating patients, and we publish all of our long-term outcomes on that data as well. Hand and wrist and elbow, that can be anything from your carpal tunnel syndrome, which is very common, wrist pain with TFCC injuries from doing things like racket sports, tennis elbow, golfer's elbow, pain at the elbow from overuse, which is very common as well, and trigger finger also. So we commonly treat those things with multiple different treatment modalities, including PRP and stem cell therapy. Hip issues that can include everything from avascular necrosis to osteoarthritis to labral tears. And shoulder, the most common shoulder problem we encounter would be rotator cuff tears. Second on that list would be labral tears of the shoulder, and then third would be arthritis of the shoulder. Ankle and foot injuries, we see those quite frequently. Big toe arthritis, as well as arthritis of the major joints, the ankle, tibial talar, subtalar joints, and then chronic sprains, acute sprains of the ankle, fractures of the foot, as well are all some common things that we treat, as well as tendon and ligament soft tissue issues, and Achilles tendon ruptures and Achilles tendon tears and inflammation. Very common. So let's talk about the different types of biologics. The oldest and one of the most common biologics that we use in orthopedics is platelet-rich plasma, and has the moniker PRP, stands for platelet-rich plasma. And what platelet-rich plasma is, it's where you take out someone's blood via an IV. So we remove the blood from a simple blood draw from a vein in the arm, and blood contains red blood cells, white blood cells, plasma, and platelets. And the platelets in the blood are one of the initial healing cells in the body. I always think of them as like a first responder when you have an injury. And so the best example I always talk about when I'm talking to patients and lay people about PRP and why we use platelets is that if I'm running down the street and I have a fall and I scrape my knee up, the first thing that happens is I bleed and then I get a scab that forms. And that scab is 100% platelets. Those platelets then produce about 2,000 different growth factors that promote tissue healing and regeneration. And then after about 2 to 3 weeks, when that scab comes off, the tissue underneath is healed. The problem with the orthopedics or musculoskeletal system is that it's very riddled with poor blood flow. So the disc in the spine have no blood flow. The cartilage in the knees and joints has no blood flow. The meniscus, only the outer third, has blood flow. So when we injure or damage musculoskeletal tissue, it turns into a chronic degenerative process. So the premise is that if we can take those platelets and growth factors and concentrate them to very high numbers, we can inject them into those damaged tissues and get a healing response to occur. Doesn't work for everything. It works better if it's more mild issues, like strained or sprained tissues or very mild arthritis, and you can get significant improvement or even healing of small tissue tears and inflammation. So that's PRP. And with our PRP, not all PRP is created the same. We use a very high concentration because what we found is that, and the literature has supported this as well, when we look at research studies that come out to say that PRP works versus when it doesn't work, it's a dosing problem. And so to get the best outcomes with PRP, we know that you need to have the appropriate dose of platelets. And the best example I always tell people about this, if you have an infant, right, and then an infant has a fever, you can give them infant's Motrin or infant's Tylenol. If an adult has a fever, you cannot get rid of or eradicate that fever or treat it appropriately with infants Tylenol or infants Motrin. It's a dosing issue. You have to have the appropriate dose to get a therapeutic response. And the same thing is true with platelets and PRP. So we go very high up in concentration, sometimes 10 times, 20 times concentrated, depending on what we're treating to make sure we can get a good outcome. So that's one of the most important things with PRP when you're thinking about getting it done somewhere. What type of concentration are they using to treat things? Stem cells. So we have a stem cell technology, we'll call it the same day, because in the United States, when you do stem cell procedures, you cannot culture, expand, or grow or keep the stem cells in the freezer or cryopreservation. You have to use them in the same day to be compliant with the current regulations from the FDA. So what that means is we usually take bone marrow in the vast majority of cases, but we can take fat tissue as well, and we minimally process that, and then we use that to treat orthopedic issues. Stem cells, I like to think of it as almost like a general contractor. When you have a stem cell, it can go into any situation and environment and then direct traffic. It tells all the other cells what to do. Hey, you go and repair that damaged tissue, you heal that nerve. But the interesting thing about stem cells that gives them the highest healing potential is that they can turn into new tissue. We don't see that with platelets or other cells because stem cells produce all the other cells in our body. So that gives stem cells the highest potential to be able to treat severe problems. So that is when you have severe arthritis, when you have large tears in ligaments and tendons, a stem cell therapy is going to be the best option for giving you long-term relief or curative function as well. Regenexx C is where we have our culture expanded stem cells, which is what we do down in the Cayman Islands because of the current regulatory landscape in the US. And we've been down here doing these culture expanded treatments since 2011, 12. And we make sure that we're doing them from a good standpoint from looking at the regulations, but also the safety. And we've published safety papers on this as well to show that these cells are safe. They do not increase the risk of developing any cancers, and they can provide significant long-term benefits for healing tissue and managing different chronic conditions as well. The main difference is that when we take the stem cells out of the body, typically from the bone marrow, and we grow them in a laboratory, we grow them to millions of cells. How does that compare to when we don't grow the cells in the laboratory from our procedures in the US? When we're doing a non-cultured stem cell procedure in the US, we're injecting roughly about 100,000 stem cells. When we're treating a knee with the cultured stem cells, we're typically injecting anywhere from 20 to 50 to 60 million stem cells into one joint. So there's a significant magnitude of more cells, and that typically tends to lead to significant improvements in outcome. Certain areas like the hip, we see that the outcomes are about 50% better when we have the higher concentration of cells as well. Stem cell banking is something that we are able to provide as well. When we grow the stem cells, we typically don't use all of them because we grow them to sometimes 100, 200, 300 plus millions of cells, and we don't need all those cells to treat one area or two areas or three areas. So what that means is that we're able to cryopreserve them to be stored and used when you need them. And so that means that we have patients that have had their cells in storage for over 10 years. They come back periodically and have treatments if they need them. Or if you're a professional athlete or just an athlete that's looking to be more proactive as well, you can come and have your stem cells banked and not even use them until you need to use them. Because as we're younger, we're able to grow more stem cells as well than when we get older. Not to say that as you're aging that your stem cells don't grow as well, that they do, but we also know that anytime that we get older, we have less stem cells in our body. I always tell people that an infant or newborn has, magnitudes of millions of fold stem cells more than an 18-year-old young adult. So as we get older, that number continues to decline. But the most important thing when we relate to stem cells in terms of quality really relates to the health of the individual. So the healthier you are, the less chronic medications that you take, as well. That all bodes to your stem cells functioning at a higher level as well. All right, so we kind of talked about this a little bit. We've been doing these cells, cultured expanded stem cell treatments since 2011. We initially were doing them in the U.S., but then the regulations changed, and we came here and have been doing them successfully since 2011, treating all of the different areas within the body and successfully treating them as well. So, what's the difference? We talked about this a little bit. A couple of things: stem cell banking. So that's a huge benefit of why patients decide to come down to the Cayman. Another one is these cells are from you. When we look at some of the other outfits out there that are doing stem cell therapy, whether that be in Bahamas, Bermuda, Antigua, etc., they're using stem cells from someone else. And the research has shown over and over again when you have stem cell therapy to treat orthopedic issues, the outcomes are better and last longer in terms of benefit when you use your own stem cells. And they're not as removed as quickly from the body when you're using umbilical or embryonic or other types of stem cell tissues. Because you're your own native cells and the body does not respond or recognize them as an autoimmune issue or as a foreign substance. So you have better outcomes and longer term outcomes are better when you use your own stem cells as well. And we can also, because we're growing them, we can treat several different joints. We commonly have patients that come in, they want to treat two knees and a hip or a neck and a shoulder and a hip or ankle as well. And we're able to treat those areas and then save the cells that are remaining for cryopreservation to use to treat at a later date, which is of huge benefit later on as well. So we have a couple of slides here that really look at some of the physical evidence of kind of what happens when we do these types of treatments. So this is a great picture of an MRI of the lumbar spine of someone that we treated their low back for disc herniation and annular tearing, which is tearing of the disc before and after treatment. So this, I remember this gentleman specifically is a European basketball player that's like 6'10", is having severe chronic pain going down the leg and low back pain as well. And so we treated around the disc for him, and he was able to have significant improvement, as you can see here, in terms of the degree of improvement. Physically seeing here, the disc was herniated here and torn through and had some tearing here as well. We treated both levels at L4, L5, and at L5S1. And you can see there's significant improvement in terms of reduction in the size of the herniation and the tearing in that disc as well. So he was very pleased with his treatment outcome. So here's another example of treating shoulder. So this is an example of a 54-year-old patient that had a shoulder treated for rotator cuff tear. And what we can see is here's the shoulder joint proper. Here's your humerus, which is your arm bone. It connects to the scapula over here. And then the rotator cuff, which is actually comprised of 4 different muscles and tendons. This one is the supraspinatus, is the one that's most commonly torn in 75% of people. It comes over here and you can see this white gap here is where the tendon is torn at. And all of this is just white fluid or inflammation within the shoulder as well. And this was after treatment. Here, we can see that that white fluid is no longer there and that tearing in the tendon has healed. So with soft tissue things, we can see complete resolution of tearing and complete healing of tendons that can occur also when the treatment is done precisely, which kind of goes to a quick segue. Whenever you're doing these treatments, precision matters. If I'm treating a patient that has this type of tendon tear, just me putting it into the joint is not going to allow these cells to magically migrate to where this tendon is torn at and heal it. You have to precisely inject this into this torn tendon with ultrasound and x-ray guidance to make sure you're going to get the best outcome as well. With that being said, also doing an infusion of IV stem cells is not going to heal this rotator cuff tear or your new arthritis as well. All right, so the next example is here we have a patient that had a hip labral tear. So this is a side shot of a hip. So here's the femur, which is a ball of the ball and socket joint. It goes down to your thigh bone. And up here is the pelvis that connects to the femur. And here is the labrum, this triangle right here. The labrum acts like a plunger and it grabs onto the femoral head to keep it into place. And you can sometimes get a labral tear, which can be common in athletes as well. And so this was treated with a stem cell injection that was precisely injected into the labrum. And you can see that tearing has healed. The tearing is this white area that's right there into the labrum. So we see good resolution of the tearing and also symptomatic improvement as well. All right, so now we can talk a little bit about the difference between here, it's cut this laser point off. The difference between Regenexx versus surgery or surgical treatment options. So there's some things that we do that are a little bit more on the invasive side, but all of the things that we do typically are needle based and minimally invasive. So we do all of our procedures typically is going to be out of a clinic and not at a hospital or surgery center. It is using needles and not scalpels. And you know, the vast majority of procedures that we do are very tolerable in terms of the pain that occurs during and afterwards for the recovery. So we do provide post-procedural pain medication and give a rehabilitation protocol that outlines the steps and phases of the recovery. And we always incorporate physical therapy with our treatments because we know that doing physical therapy is what's going to lead to you getting the best long-term outcomes, right? There's a reason why we all end up with the problem. It can be an acute trauma, or sometimes it's a chronic issue, and we ultimately have biomechanical problems that are a result or the cause of that issue. And so, if we don't address the biomechanical issues, you're going to have some issues and problems in the long term. So, we always have physical therapy incorporated with our treatment protocols just to make sure we're addressing any underlying biomechanical issues. With that being said, also when you come in to see us for your initial evaluation, we sit down with you, spend a lot of time, usually about 45 minutes to an hour, to go over your issues with you, do an examination, show you your MRI pictures. But also, if you just come in with knee pain, we're not just going to do an examination of your knee. We're going to look at your hip, your knee, your ankle, and the entire biomechanical chain, including your lower back, to see how these areas are influenced by one another and see if the knee is the true issue or if there's any secondary issues coming that are a part of that that need to be addressed as well. Minimal complication risk. So there's minimal degrees of complications that can happen from these procedures. You know, typically we try to mitigate those and make sure everything is done at a high level, but the risk of complication is still significantly lower than any surgical procedure. And the recovery. So, for example, when we have patients that we're doing very aggressive knee treatments, you still walk out of the office. There is no period where you're non-weight bearing for 6 weeks. You can't move your shoulder after a shoulder rotator cuff procedure. We have you doing rotation and range of motion and mobility work within 24 hours because we know that a joint that moves tends to usually have a better outcome as well. And so we usually start physical therapy in about 2 weeks out, but the recovery is much quicker. And then repairing and regenerate. You know, we don't regenerate all the tissue for the structures that we treat, but the goal is to do a couple of things. We want to decrease inflammation, we want to stabilize tissue and joints, and we want to regenerate the tissue when we can. So some things like arthritis, that may not be a lot of regeneration that's going on. We can see some regeneration of the cartilage, about 15%, but arthritis is an inflammatory problem. And so our goal is to get rid of the inflammation, stabilize the ligaments around the knee, get some regeneration of the cartilage, and that's what allowed us to get 5, 6, 8, 10, 12 years of benefit after one treatment. So that really matters as well. So this kind of segues directly into recovery and return to activity in sports. So typically we will have some rehabilitation protocols. We have about 55 to 60 total for each of the different areas that we treat that's very specific. And so it's broken down into phases of the recovery, phase 0 through phase 4. And phase 0 is typically day 0 through day 3. It tells you what you can do, what you can't do, and when you can move on to the next phase. But initially, you're taking it very easy for the first 12 to 24 hours. After that, the next day, you're doing some range of motion. Then we get you doing some cycling and swimming in the pool, and then starting some physical therapy and weight within about 7 to 14 days as well, depending on what we're treating. also. But the goal is not to immobilize, which leads to more muscle loss and also a more difficult recovery and usually causes more constriction in the soft tissues. So why patients choose Regenexx Cayman? I mean, obviously we've talked about these things, but just kind of looking at the high points, we have a higher concentration of stem cells that we're injecting. Your stem cells come from you. There isn't another clinic out there that we're aware of that's doing bone marrow stem cells or adipose-derived stem cells that are coming from the patient's own body. These are third-party source stem cells coming from multiple different vendors that are then treating other areas. We're able to treat a wide spectrum of issues from soft tissue issues to joint issues with arthritis, disc issues in the spine, nerve issues, pinched nerves, etc. And we focused in on orthopedics. All of the physicians here are, as I mentioned earlier, well trained, fellowship trained, US board certified physicians that are experts in the field. You can bank your cells, right? So you can cryopreserve your cells if you need to use them in 5 years from now, 8 years from now. We have that option and that luxury to be able to do that. And every treatment plan is tailored towards you. So, meaning that if you go back to looking at how we do our initial intake, when we have a phone call with you, whether that's remotely, because we have patients that may be in Thailand or Vietnam or even in the US, we spend about 30 to 45 minutes getting to know you, showing you your pictures and your imaging. But if you decide to come in, we still spend time with doing an examination to make sure we understand the biomechanical limitations that may be contributing or a direct result of the problem that you have. So we make sure that your treatment plan is tailored just for you. It's not a meal or farm where we bust you in, you come in, you see a nurse practitioner, they're injecting something into your joint, hooking you up to an IV, taking your money, and you're out the door. We don't operate like that. Our goal is to make sure that you're getting the best care for long-term success. And everything is image guided. So we don't do anything blind. We use a high definition ultrasound and live x-ray or fluoroscopy for all the treatments that we do, either one of the two or both together, depending on what we're treating as well. There's been research that has been published time and time again that shows the outcomes directly correlate when imaging is used versus not used. So when you do things blinded, the accuracy is lower and the outcomes are not as great as well. And we publish a lot of research as well because we believe in transparency. So in order for us to get patients better, we need to know what works and what doesn't work. And that means that we need to be involved thoroughly with you before, during, and after your treatment. So we're always communicating back with our patients after we treat them, 1 year, 2 years, 3 years, 5 years, et cetera, down the line. Hey, how are you doing? What's your current functional status? What's your pain level? How are you feeling? Would you recommend this treatment to someone else? How can we improve our treatment outcomes? And then we published our research as well, just to make sure it's as transparent as possible and that the community, the scientific community, can learn from what we're doing as well. Safe and luxurious destination. If you haven't been to the Cayman Islands yet, it is extremely safe, probably top 3 safest countries in the world. Beautiful beaches, lots of first world amenities, including every hotel and resort that you can think of, from the Ritz-Carlton to the Kimpton, also with great restaurants as well. And we've treated multiple professional athletes in the past and currently, even over the past month, professional NFL athletes as well. And so we have a testimonial by Ryan Tannehill that's on the website that we'll be able to send you the link to as well also. And this is a link to one of our video testimonials that we have and video explanations that we have that kind of goes over what to expect during the virtual consult. So you can visit our YouTube and Instagram page. It has a lot of information of the process. So that way you're as familiar as possible with kind of what the steps are in that process. All right, and this is our contact information. So please feel free to reach out to us at any point in time. We're happy to chat with you about any questions that you have about if this is something that may be a good fit for you as or your loved ones or friends or family members. So we're always very open and accessible and would love to help you on your treatment journey and maintaining an active lifestyle and allowing you to do things you love to do. So I think that I will open questions up. Actually, we have 4 questions in the Q&A. So I'll go through these first, and then I'll open up to a live Q&A session here as well. So first question is, can stem cell injections help with injured and inflamed muscles? Yes. So, there's a lot of research that shows that when you have chronic muscle inflammation, whether that be from chronic muscle tearing or micro tearing, you really need to have a certain type of treatment, including platelet poor plasma with stem cell therapy to get good long term results. But we've treated athletes that have torn their muscles and have chronically inflamed muscles, whether that be adductors, hamstrings, etc., with pre and post treatment images showing healing of those issues as well. But yes, thank you for that question. All right, the next one. Is an IV infusion in any way effective for anything, or do you need to inject perfectly in specific points only? Yes and no. So an IV infusion is great for certain things. There's been about 70 to 80 randomized trials showing that IV infusions work great for conditions such as rheumatoid arthritis, multiple sclerosis, lupus, heart failure, Parkinson's disease. So if you think about more neurological conditions or whole body inflammation, these treatments with IV infusions have shown to be extremely beneficial. People that have interstitial lung disease or pulmonary fibrosis, asthma, all of those types of conditions tend to respond well to those because when you do an IV stem cell infusion, the stem cells go through the lungs, and about 70 to 80% of those actually trapped or sequestered in the lung tissue, and then about 20% move throughout the body. So great for some things, not really good for treating a torn tendon or arthritis in the joint. All right. Next question. How long does a tendon tear take to heal with this approach? Great question. So, when you have a soft tissue tear of a tendon or a ligament, it takes about 16 weeks for the body to go through its entire healing cascade, or about 4 months. And if you look at some of the papers that we've published that are on our website, we have pre and post treatment MRIs showing that. So, when we look at conditions such as anterior cruciate ligament tears or rotator cuff tendon tears, we have before and after treatment where we can see that ligament fully heal. And it really usually takes about 16 weeks for that to happen. Next question is please explain the process of drawing the required blood products, etc., including the bone marrow. Okay, very good. So the bone marrow is a blood draw is just a simple blood draw, but the bone marrow aspiration is done where we aspirate the bone marrow with the needle from the back of the pelvis. We aspirate it from a specific site on the back of the pelvis called the posterior superior iliac spine. Is from a research purpose is shown to have the highest density and concentration of stem cells in the body. We anesthetize the area. Sometimes people decide and opt to go to sleep, which we can do that with an anesthesiologist or with light sedation. We also have nitrous gas, or some people just do it with local sedation. I've had it done twice myself, and I just use local sedation and work the rest of the day after that. It's not a very uncomfortable procedure, but for some people it is uncomfortable as well, and it takes roughly about 15 to 20 minutes to do. With the next question we have is where can I find the published research and proven results? So if you go to www.regenexx.com, and then actually I'll pull it up in just a second here on the screen so that way I can specifically show you as well. So let me stop the screen share for this. And I will share my screen again here. So if you go to www.regenexx.com as is here, and you can go to a couple of different things, but if you go to resources directly at the top and published research here, sorry, this is www.regenexx.com. You go to resources and then published research. And then this will go through all of the Regenexx research that we've published over the years. And so here at the top, it will have the latest publications. And then down here, you can find all of the historical publications that we've published dating back to 2006. So all of those are there. Great question. All right, I'm going to stop sharing that. Okay, next question. You mentioned ACL and MCL treatment. What about a 50% patella tendon tear? Are there any side effects? That's a great question. If you have a very large patellar tendon tear, then PRP is unlikely to be very effective in conditions like that, or Achilles tendon large tears like that as well. Usually respond much better to stem cell therapy. So yes, we have successfully treated large tears of patella tendons, Achilles tendon, rotator cuff tendons that do very well. Side effects, there's not many side effects. The most common things being common is pain. So there's a pain response in these treatments, and typically for about 7 to 14 days, having some level of pain post-treatment, which it is a procedure, there is some pain, is the most common thing. I've never had anybody that has had an infection in any tendon after having these types of treatments done as well. There is a theoretical risk that the tendon can rupture from having a treatment done, but again, that's not something that I've ever had the experience with or seen firsthand, and I've been doing these procedures for over the past decade. Good question. Next question. Would stem cell therapy help with CAM impingement, labral tear, arthritis, and bursitis of the hip? That's a great question. Yes, that's something that we treat commonly all the time. So CAM deformity, meaning that you have a little bit of extra bone on the in the hip, and that typically is very common when you have a labral tear or hip instability. And so the body does not like an unstable joint. So when you have a tear of the labrum, of the meniscus, etc., the body deals with a joint that moves too much by producing more bone because it can't heal the damaged tissue like we talked about because the blood flow is so poor. So when you have a labral tear, a meniscus tear, etc., it makes more bone and starts the process or cascade of developing arthritis. So when we treat these areas, whether it be a spine condition, a knee condition, or a hip condition, we treat the area comprehensively, meaning that for a knee injection, we may be doing 10 injections for that knee because we want to inject all the ligaments, the meniscus, into the bone to help treat the arthritis and also the cartilage as well. The same thing goes for a hip. So when we're treating somebody that has CAM impingement, we don't want to just treat for the CAM impingement. Why do you have CAM impingement? And we look at your biomechanics. We treat the ligaments around the hip to stabilize it. We treat the labral tear. We treat the arthritis and any bursitis of the hip as well. So absolutely yes. Next question. You mentioned that stem cells grow less rapidly as you age. How does this impact elderly patients? How often do you treat seniors 70 plus years old? And how long do the treatments typically last? Great question. A little bit to unpack there. So, not that the cells grow less rapidly, is that as we age, we have less stem cells in totality in our body. That's just the normal process of aging. How fast the stem cells grows really depends on the overall health of the individual and the genetics as well. So we see that patients that are dealing with a lot of chronic medical problems, that take a lot of chronic medications and are just not as healthy, typically don't have cells that grow as fast and don't have cells that grow as robust. They don't grow as many in terms of numbers. Our average age of patients that we treat is over 60 years old. So we have quite a few patients that are over 70 that get treatments, and treatments can last for several years. We have patients that I just published a research study looking at long-term outcomes after treatment of rotator cuff tears, and we have patients that are 10 years out after one treatment that are still doing well. In December, I published a study looking at our 10-year outcomes for treatment with intradiscal stem cells for lumbar degenerative conditions. And we had several patients that were 10 years out that are still doing great. So everybody's a little bit different, but you can get many years of treatment benefit after one treatment. Great question, though. Next question. Do you use peptides along with stem cells? That's a great question. We have several patients that do use peptides. We have a couple of different experts in the field of peptide that we can connect our patients with to use peptides. The issue with peptides is two things. There's no human studies to show that peptides actually work to treat anything. But anecdotally, I've had several patients that have had benefit from using peptides, so I don't have a problem with it. The second thing is the quality of the peptides. So the peptide is only as good as the source, and there's a lot of bad actors that are distributing poor quality peptides. So currently peptides are just used for laboratory studies. There's no clinically approved peptides on the market. Hopefully that will change soon. But yes, we have several patients that use peptides, testosterone, BPC 157, the whole slew of them with good results. In some patients, it doesn't help at all, but I'm open to it. I always try to link them up with the provider that can provide them with a good source of quality peptide. Good question. All right, so we have lots more questions. I'm going to crank through them, guys. Please be patient with me. These are great. After stem cell treatment on the hips, how long do you expect the patient on crutches? How long can before the patient can get back to swim activity in order to recovery? That's a great question. So, depending on what the issue is with the hip, if we're treating for arthritis or necrosis of the bone and we have to drill into the bone, we have the patient on crutches for about 24 hours. If we're treating for a labral tear or something of that nature, more soft tissue structure, we don't do any crutches and the patients walk out of the treatment. And we usually recommend waiting to swim for 24 hours unless we're treating into the bone for severe arthritis or necrosis, where we give you about 72 hours of no submersion and water restriction. But with that being said, we do have you doing other things within that 72-hour window, working on range of motion and stretching and stability work as well. So never any point of inactivity or immobility. All right, next question. What is the cost? The cost for cultured stem cell therapy can vary, but the baseline cost can be typically roughly around about $21,000. It depends, but we have that's for cultured stem cells. For PRP, the average cost maybe a starting cost is somewhere between $2,000 to $3,000. And for non-cultured stem cell procedures, that cost can range anywhere from beginning somewhere around about $5,000 to $6,000 and up. It really just depends on what we're treating because every treatment plan is tailored. So because if we're treating two knees, a shoulder, and a hip, that's going to be a very different price point and price structure than just treating someone's big toe. So what you're getting treated, how many areas are being treated, and what you're being treated with, all depends and determines the cost. Good question. All right, next one. I visited a clinic here in Florida and they recommended placental cell treatment for my osteoarthritis and that stem cells from our bone marrow is just using stem cells from a 7-year-old person and would not be much improvement. A lot of false information. There is a lot of clinics that are, for number one, the first thing with this is that's not great is there is no FDA approved source of placental or umbilical stem cells that's on the market in the United States. And there's been about 6 studies that have come out to show that all of the products that are currently being sold contain no living stem cells. So there's nobody in the United States, unless you're doing a certified clinical trial, usually typically from a university, whether that be Emory, Duke, University of Miami, Harvard, Stanford, that's going to be doing a clinical drug trial that's not charging you for it, which is what you can do in the United States. If it's not that, if it's just a run of the mill clinic saying that they can do placental or umbilical or warts jelly, stay away. They're not using any living stem cells, and there's been several papers published to show that. And also, the Federal Trade Commission and the FDA has been cracking down on these clinics like nobody's business, and actually doing a lot of legal action against these clinics for consumer fraud and misinformation. So stay away from that. And again, going back to the age, it's not really the age, it's the overall quality. So, yes, there's a number differential between younger and older patients, but the quality is largely reflective of yourself and your health. So, if we when we talk to patients, we do a little bit of functional medicine to see how we can optimize the health of the individual. So, what's your diet like? What's your inflammatory profile? We look at certain laboratory studies and look at the vitamins and supplements that you're taking. We may recommend intermittent fasting. So all of these things go into helping, your overall protoplasm, right? How healthy you are, which then is a function of how healthy your stem cells can work for you. Also, there are certain medications that we can pull back on that are known to be toxic for stem cells. So all of those things are important. But good question. Next one. What is your experience and success rate for degenerative arthritis at L405, depending on the remaining disc space? Does it depend on the remaining disc space? So yes, we've treated successfully. Personally, myself and the doctors here had great success with treating disc degeneration, disc herniation, and arthritis in the lower back. The remaining disc space can be important, but depending on what type of problem we're dealing with. So yes, if you have the more disc space over time, then that typically can lead to a better long-term amount of cushioning in the low back. But we've treated patients that have severe degeneration and severe flattening of the disc. that still have great outcomes. So it really just depends on what we see on the MRI, and then we're able to come up with a specific treatment plan from the examination and the MRI combination and what you're telling us are your symptoms. Because just because you have a flat disc, that doesn't mean it's causing your problems. We know that about 50% of people that are walking around have severe degeneration on the MRI that are over the age of 50 and have no pain. So we really try to put the pieces of the puzzle together and not just treat the image. Basically, looking at what your problems are, what the examination shows, and what the MRI shows in combination to come up with a very specific and tailored treatment plan. Good question. All right. Next question. What or where do people stay for accommodations and how many days in the stay? That's great. So we have a concierge that works directly for us that sets you up with accommodations, and if we can do the scheduling for you for your hotel accommodation, or we can give you the information for yourself. But we're able to provide discounted rates for all of the hotels, whether that be the Hilton, the Westin, the Ritz, the Holiday Inn. There's a spectrum of cost-effective options to high-end resorts as well. We set that up. We provide transportation for you to and from the airport and to and from your clinic appointments as well, and provide a nice welcome package with a lot of information, including activities, restaurants, etc. So that way you can do some other things than getting treated during your stay. All right, next question here. When was the last time that you updated your technical process for freezing and thawing? I've heard recovery percent can double with techniques developed in the last 4 years. Yeah, so we have a full-on laboratory here with several different cell biologists. So we always look at how can we advance the process. We have been doing this longer than anybody else. We have the largest clean laboratory room in the Caribbean as well, and our freeze thaw process is very, very, very meticulous as well, and very different. So we always look at the viability. We look at testing for endotoxins as well. Also, before we do any of these treatments, to make sure that the cells of as high of a quality as possible. Great question. Pre-treatment with stem cells. Does Regenexx do any blood cleanup work is done outside the U.S. to optimize health of individuals to be treated with stem cells? Yes, that's a great question. So yes, we typically recommend having a subset of laboratory labs or blood panel check, depending on what your overall health issues are. And also there are several different supplements that we recommend that we have looked at in-house, and the research has shown to actually improve stem cell function and overall decreasing the inflammatory profile within your body. But yes, we do. Absolutely is very important. Next question. Is there any role of stem cells in regenerating dead or permanently damaged motor neurons, such as in post-polio cases? 45 years old with post-polio residual paralysis, right lower limb. My arthritis symptoms start in the first metatarsal joint. So yes, post-polio syndrome is very complicated, and typically if you have chronic nerve damage 10, 15, 20 years old, there's not really a stem cell therapy that's going to allow that nerve to drastically regenerate. But what we do commonly treat with post-polio or Charcot-Marie-Tooth syndrome is the secondary effects of that. So when you now have arthritis, we can treat that. If you have new pinching of nerves secondarily to the initial post-polio issue, we can treat that as well. When you treat nerves, you want to treat them as soon as possible, because once nerves die, they are very difficult to treat, meaning when you can tell a nerve that's injured versus dead. An injured nerve hurts, so meaning that you have numbness, tingling, sharp, shooting, stabbing pain. A dead nerve, there's no more pain, and the muscle has atrophied, and that's affected the joint health. So, there's a difference of what we're dealing with and where you are at on the spectrum of that nerve injury. And so I'm happy to take a look and talk to you specifically about the case-by-case specifics. Good question. All right, how long do we stay there? That's a great question. So for the bone marrow aspiration, it's really kind of a 24 to 48-hour process. We have a lot of patients, depending on where they're traveling from, coming in. They can come in and leave on the same day or leave the following day. As I mentioned, the bone marrow aspiration takes roughly just about 20 minutes to do, but we always want to make sure you're hydrated. In addition to the bone marrow aspiration, when you come, we do a physical examination, go over the imaging, go over the biomechanics, and talk about everything in terms of the recovery and answer any questions that you have as well. So there's a little bit of logistical issues that go along with that. And then it takes us a month to grow those cells in the laboratory. And then we have them frozen and you come back. When you come back for treatment, how long you stay when you come back depends on what areas are being treated as well. That can be as short of a 3-day window to upwards of a 6-day window, depending on what all we're treating. Good question. All right, next question. We have a lot of questions coming in. You guys are awesome. If you need to jump off by any means, please do so. I'm going to keep cranking through these questions. I think we have about 89 questions that have come in now. So next question. I mentioned the use of interstitial lung disease and Regenexx doing treatments for this now? That's a good question. So we're actually in the process of doing IV stem cell infusions coming up here soon for conditions like interstitial lung disease or total body inflammation or just longevity and health as well. Not being done currently, but we're hopeful within the next couple of months that will be done here as well. Great question. If recovery is, say, 16 weeks long, how many times do you come to Cayman or stay in the Cayman? So you don't have to be here for the recovery. What we do is when you leave here for treatment, after the treatment, we get you plugged in with the physical therapist locally. We give you a rehabilitation protocol, and then we have follow-up with you because that's vital. We usually do if you're local or if you're flying in, or we do a Zoom to go over your recovery process, usually at about the 10 to 12 week point to see how your recovery is coming along, any roadblocks or issues or hiccups that you've had, and how the therapy has resolved and how your activity level is as well. Great question. We have 137 questions. You guys are awesome and very engaged. Love it. All right, we're going to keep plugging here. Next question here. What is the last age a person can opt in for stem cells to be stored? Can they be over 60 or do their stem cells are effective or do they require donor cells? Yeah, I think I kind of touched on this already, but as long as you're alive, your stem cells are functioning. How well they're functioning is depending on the quality of your overall health. So, we look at a lot of different things, your medication profile, the medications and health issues that you have, and then also your laboratory panel to see how we can help optimize your health. But we have several patients that are 70, 80 plus years old that have cells in storage. So, really just want to make sure we functionally optimize you to make sure you're as healthy as possible. Thank you. All right. Let's see here. The audio volume has decreased and difficult to hear. I'm not really sure if anybody else is having that issue, but please let me know. I haven't changed any quality or settings on audio here. So hopefully everybody's able to hear me. All right, next question. Can meniscus and cartilages be regrown completely with stem cells? Absolutely not. There is no data to suggest that you can take a completely severely degenerated cartilage and get it to 100% regenerate. In the laboratory, we can see that in animal models, but not in humans. We see about 15 to 20% regeneration of cartilage. Now, a meniscus tear, if you have a torn meniscus, we do see that you can get that meniscus tear to heal. But if you've had a meniscus that's been surgically removed, like a meniscectomy, there's no amount of stem cells that we're going to inject in there that's going to get more meniscus tissue to regrow after that. Good question. Hip labral tear success rate. Great success, does well. You have to do physical therapy because you tore the labrum for a reason, but hip labrums do well. Good question. Next question. For degenerative disc disease in the lumbar area related to treatments, how much more effective are the Cayman treatments versus Regenexx, PRP, and lysate treatments? Any published data comparing the two? If I'm not clear if I'll continue with regular Regenexx treatment, come to Cayman. That's a great question. If you have started with PRP and platelet lysate treatments with Regenexx and you're having good outcomes, always recommend maybe considering starting. If you have a Regenexx clinic locally, then having an evaluation there is great. If you haven't had good success with PRP and platelet lysate to the lumbar spine, then doing treatment with culture expanded stem cells is probably the next step. So if we're able to get you good success with PRP and platelet lysate and you've done well with that, that's fantastic. I will continue doing that treatment modality. I think that's awesome. But if it hasn't been successful or the results have not been long lasting, then cultured stem cells is probably a better option for more long-term success for you. But thank you and great question. Next question, can this help with incomplete caudate equina with bladder and bowel dysfunction? Yes, I've had several patients that have had spinal cord issues, either related to traumatic injury or with disc degeneration causing large herniations and compressions of the nerves as well. We typically treat around the caudate equina, and you can see some improvements with treating the nerve roots and allowing the nerves to heal there as well. Has not been published on yet, so I would say it would be more anecdotal of personal experience, but it's worth considering. And we typically do that with PRP, and platelet lysate treatments tend to work well there. Good question. Next question, can meniscus and cartilage tissue be regrown? Got that already. I'm going to go to the next one. Are these procedures covered by insurance? That's a great question. So we do have some coverage of stem cell therapy in the United States by self-insured employers. And also a couple of patients have had their self-insured employer to cover their cultured stem cell treatment as well. We've had probably about two of those, not that many. But it becomes a very easy conversation when you're talking to an employer versus a big box insurance company about the benefits, financial and outcomes benefits with treating patients with a biologic versus surgery. For example, when we talk about a knee treatment, say a stem cell therapy treatment, whether it be non-cultured, costs $6,000 and cultured costs $20,000. A knee replacement on the cheap side is $30,000. And that's not even to include the rehab costs after that, the loss of work. The patient's going to have to be out of work for several months as well. So when we talk to employers about the cost savings benefit, it's an easy thing. We get to show them the outcomes that these patients do just as well as patients having knee replacements. They're back to work within 3 to 7 days. And the outcomes and complication rates are significantly better as well. So yes and no. There's no coverage through your Blue Cross, your Aetna, Cigna, et cetera, United. But if you have an employer, we do have self-insured employers, so many of those corporate contracts that do provide some coverage for these procedures. But by and large, the vast majority of people that get these procedures are out-of-pocket payments. Thank you. All right. Next question. If you can culture stem cells at a massive rate, why does it matter if the initial pool shrinks with age? Why bank? So yes, that's a great question. So you can only grow stem cells so many times before you start to cause genetic issues. So because that leads to unchecked growth, and that's essentially cancer, right? Because cancer is just when an isolated cells grows and replicates over and over and over again unchecked. So what we do with the stem cell therapy is we take the stem cell, we grow it for what we call a pathage, where we grow it, we take the cell out, we grow it again, and take it out one more time and grow it. Then we freeze it to stop the growth because you don't want to continue growing it, because then that can lead to cancer cells as well. So that's why we do it that way, so it's safe. And banking stem cells just allows us to have any cells that are left over to use later. You don't have to bank the stem cells, but ideally, most people want to use those cells left over. Good question. Can meniscus cartilage be regrown? We answered that one. Getting some duplicates here. Meniscus cartilage. Okay, next new question. What's the quality of cultured stem cells relative to newly harvested compared to placental stem cells? So the quality of the stem cells versus newly harvested are pretty much the same. We always, when we initially culture and grow them before we freeze them, we look at the viability, meaning how many of the cells are alive. And then when we take them out of cryo or thaw them out, we look at how many of the cells are alive as well. We always have an 85 to 90% viability rating that we want to achieve. So the cell quality of the non-cultured and cultured is pretty similar. And compared to stem cells, most of the time, depending on where they're sourced from, it can be similar, but overall research has shown that when you inject placental umbilical stem cells in the body responds to them as a foreign substance, and they don't stick around that long, typically in the realm of a couple of hours, whereas when we look at cultured stem cells, it lasts much longer. All right, very good question. Next one, that's a repeat. And that's a repeat. Does insurance cover any of the cost? We answered that. Okay, we're just going to go through here. That's a repeat here. All right, next one. Where are placental stem cells available outside of the U.S.? If you do a quick search to Chat GPT or Gronk, you'll be able to get a list of places throughout the Caribbean or throughout the world that do placental umbilical stem cells. All right. I think that is. Oh no, there's uh, a couple more here. Can you reinfuse adipose harvested stem cells via IV slow for 4 to 8 hours infusion for a general touch up, not non site specific? You can reinfuse culture expanded adipose harvested stem cells. You cannot safely infuse fresh adipose tissue, or you could cause somebody to have a blood clot or a clot in their lungs called a pulmonary embolism and die. So, culture expanded adipose stem cells, absolutely, as well. But infusing fresh adipose tissue, very dangerous and should not be done. All right, let me see here. Next question. The risk of malignancy associated with stem cells is virtually zero. There's been three great published papers that have come out. We published one looking at the safety and efficacy of our stem cell treatments that showed no increased risk of cancer or malignancy development. There was a French orthopedic surgeon that published two papers, and patients with active cancer where they had bone cancer, they took the bone cancer out and then they injected their own stem cells in the site of the bone cancer where it was at and followed them for 12 years, and there was no increased risk of developing any new cancer as well. So very safe, and there's been no study to show that there's any risk of new cancer development. All right, and we have a lot of repeats from the same person. Here are a couple of new ones here. If I bank them for 15, if I bank them there for 15 years, will half the cells still be thawable and effectively work? And have you done any of the past patients pre-2015 with cells in the past year? Yes, I actually just spoke to a gentleman today that has had his stem cells banked since 2015. Last year, we treated a couple of patients that had cells banked since 2012 as well. But yes, the cells are always checked for viability and sterility testing before we use them as well. But several patients have had cells that have been banked for 10 plus years, and there's no issue. They're isolated and suspended in time, they're not growing or changing. But good question. Next, we have, can you transfer frozen one's own cells to your office years later? If not, then a European clinic with extra services in a hospital for injecting. I think this question is asking, can you take your cells that have been stored here and then send them to be injected at another location? You potentially can. That's going to depend on the regulatory state of that second location, whether that be in Europe, the US. So each state has their own regulatory body that decides how you can handle biological tissue and if that's legal to do or not. So it's going to be on a case by case basis. Good question. We just have a couple more, I think three more here, and we're all done. Do you process adipose lymphatic stem cells or just derive from bone marrow? Which stem source has better outcomes for HIP, OA, and AVN? Yeah, we use bone marrow and adipose adipose extracted stem cells as well. Bone marrow has been more widely studied, and especially when you talk about arthritis and AVN. There's studies going back to the 1980s with treating hip avascular necrosis with bone marrow derived stem cells and arthritis as well. So MFAT, there's been studies looking at treatment of knee arthritis, not many for hip arthritis, and there's no study showing that arthritis treatment with MFAT greater than 2 year outcomes. And we have studies looking at bone marrow for treatment of arthritis going out to 15 years. So the data is more in favor of bone marrow, but you can use fat tissue as well. Good question. All right. Is there a limit to having stem cells after equine injury? No, there's no limit. The only contraindications or limitations with stem cell therapy, certain health conditions like active cancers and or bleeding disorders as well. But we really evaluate things on a case by case basis. But for cauda equina specifically, no. Do you accept MRI to use, or do you need to do your own testing? Yes, if you have an active MRI or recently done MRI within the past, typically year and a half to 2 years, We get you connected with our patient care coordinators, and they walk you through the steps of uploading that to our system so we can review that for our call, go over the pictures with you so you understand what we see, and then come up with a specific treatment plan based upon that as well. But yes, we always need imaging. We don't do anything based on just what you tell us or an X-ray. When we're doing these things, we need to see specifically. Because an MRI is like a 4K television, right? And X-ray is like an old black and white television from the 1970s. So big difference. All right. Next couple questions and we're all done. Two more, I think. Which type is better, stem cells from the bone marrow, umbilical, or placental? Well, I'll say this, it depends on what you're treating, but if we're talking about orthopedic issues, bone marrow stem cells has been the best studied. And when you're using stem cell therapy from your own cells, the outcomes have tended to be better from a research perspective as well. But all of these therapies can be beneficial and helpful for treatment depending on what you're treating. Any experience with scalp or hair loss injections or jaw thinning? There are a lot of aesthetic locations doing biologic treatments for aesthetic reasons, whether that be skin and collagen repletion, hair loss. I typically have referred a lot of patients to a credible and reputable clinic location I know in the US that does that. We don't do that specifically. And also the same for things like erectile dysfunction. We don't do any of those types of things, but I do have people that are specialists, urologists, et cetera, that do these things in their field that do it at a high level. And the last one, how many times in the past 2 years have you yourself harvested your own? Oh, yeah, I've only had mine harvested twice in the past decade. Once I did it the first time in 2016 to see how it felt. I just wanted to know. I always like to know how these feel from a patient perspective so I can actually give credible advice and information. And the second time I did it to have my cells banked here, and I believe that was in 2017 as well. And I have not had any other aspirations for banking since then or harvesting. I still have my cells here, and I've had probably over 30 treatments for different musculoskeletal issues and injuries, everything from running, weightlifting, snowboarding, and living life with 4 kids and being active as well. So I've had the run of the mill of everything treated. So I believe that is a completion of the questions. Actually, there's someone with a raised hand here. Let me see. Um, all right, Ms. Carol, I'm going to allow you to speak if you want to. You're muted. So if you do have a
I
question,
just thought you were ending it, so that's why I raised my hand, but I did put it in the chat. The question is there a replay of what you're telling us right now? Can we get it again? It's been very, very helpful, but I'd love to listen to it again.
yes, very good question. Yes, we are recording this session, and our marketing team will be able to allow you to visualize and view the segment and replay it back on your own time. I'm not sure on the timeline of when that will be available, but yes, we can get you the transcript and the actual audio visual copy.
Great, thank you.
Thank you so much. Well, guys, I have to go and treat some patients. It's been my pleasure. Thank you so much for the fantastic questions and the engagement as well. And my contact information is available, and I look forward to hearing from anybody and helping out however I can. Please be safe.